said at the outset, health is a basic human right. Without that, nothing else can emanate. So, Minister of Finance, when you're looking at all these competing priorities and so on and so forth, actually, we should be top of the list.
I think if you go to a Ministry of Finance and say this health is a human right, you won't get very far, to be fair. The job is to say that health is a human right, and here's an efficient way of paying for it, because this has political capital associated with it. So demonstrating those returns on investment is the language that Ministries of Finance understand. So it's the economic efficiency and the human rights arguments.
The health is not created in the health sector. Health is created in the other sectors. Health is created in the good schools, good local communities, kindergartens, sport, culture. So if we, as Minister of Health, should have one line to our Minister of Finance and said, all the money we can use, give it to us, then we will destroy the sectors that actually is creating health, and we have used all the money on repairing unhealthy lives. So we have the need to have the balance, because we need to use more money on the sectors that actually is creating health. But then, of course, we also need to use money on health. But most important, we have to prevent what we can prevent. And that is, of course, in areas connected to sugar, tobacco, alcohol. In these areas, we need to use the tax system to reduce the burden of the health sector. And Norway have high level on taxes on all these three commodities, and that gives results in lower use, lower cost, and better healthcare system for the people that really need the healthcare system, not for people that actually don't need it, because you can prevent it.
I'm all for taxes on cigarettes and sugar. We know what the effect is. The evidence is large enough to know that it has such a huge population health impact. So I'm all for that. But let's not forget that currently in the world, high-income countries spend $9,000 per person per year. Middle-income countries spend $2,000 per person per year on their healthcare. Low-income countries spend $165 per person per year. These taxes are never going to be enough to address universal health coverage in low-income settings. So there is a need to look at a different way of financing universal health coverage. And one way to do that is obviously partnering with different sectors, as I explained. In our example of urban health initiative in Ulaanbaatar, the capital of Mongolia, the highest cardiovascular mortality on earth. We work together with the food and agriculture sector, the tech sector, the transport sector, and the health sector, and we form a coalition to address both the underlying determinants of ill health and the gaps in the health system. And with that, the mayor of Ulaanbaatar, he told me the first time I spoke to him about that, this is exactly what my city needs. Here's my budget.
We really do want to incentivize citizens to wellness and well-being. So when I made the reference earlier to data, we want to make the transition in terms of the prevention, in terms of being able to manage the non-communicable diseases in Barbados, of which diabetes, hypertension, stroke, the classic diseases are there, and therefore the cost associated with treatment of those NCDs obviously has escalated over the years. And so as we go through this exercise in collaboration with the private sector, as I mentioned, we are treating this as an investment in the future of the country, because at the end of the day, we do want to have productive citizens who are capable, obviously, of going and living their best lives, but also producing in the context of the economy.